Keith Muse is a member of the group, and he joins us now in Stephenville. Keith, thanks so much for joining us this morning and taking the time.
Good morning.
So let's talk about this sign. We just saw that image of it. How did it come about?
Well, we started advocating for COVID safety, at the start of the pandemic, and we've kind of shifted our focus to education, mitigation, and air filtration. And it rhymes, or it's a catchy three-pronged approach to COVID mitigation. So we don't feel that the government is providing enough information to the public. So we really wanted to get that word out there.
Yeah, and getting that message out there is so important, and in such a visual way. You also have a personal connection to long COVID. What can you tell us about that?
My son caught COVID in May of 2021, and some of the lasting effects that he experienced really worried us. So I got to researching COVID and long COVID and things like that, and during that time, I connected with other advocates around the country, and when I did so, different advocacy groups brought to light some facts that were very concerning to me. So, out of New Brunswick, they did an ATIP on long COVID through their government, and what they found was all the chief medical health officers of Canada have had information on long COVID since July of 2020. And unfortunately, they haven't shared that information with the provinces. So that's very concerning. So.
And I can see how your personal experience has really fueled what you're doing now. You're also working with those in your group who have also experienced long COVID. So what are they saying about this?
It's a devastating condition. So a lot of people really don't know the prevalence of it. So StatsCan report came out last week, and it showed that 3.5 million Canadians had reported, some form of long COVID, which is very alarming because, again, that information isn't being passed on to us by our governments. And our current COVID policies really aren't, mirroring or matching the current reality, right? So a lot of people think that COVID is gone, and it really isn't. And when you see these numbers, 3.5 million, which doesn't include kids, that's, it's highly concerning. So a lot of people are walking around assuming, okay, COVID is gone or it's mild, but it's, mild viruses don't cause millions of people to have lasting effects, right? So. And
what are some of the lasting effects you've been hearing about?
Well, some of the most common ones are, extreme fatigue, breathlessness, issues with the heart, things like that. And I mean, it can manifest in so many different ways that many people don't even know what they're looking for, right? So the problem with that is it's a lot of it's going undiagnosed because really, if people don't know what they're looking for, then how can they find it, right? So that's why it's really important for this education component, to our three pillars of, mitigation, air filtration, and education. It's really important to educate the people because if they know, okay, if I have this, thing going on in my, I'm breathless, for months at a time, it could be long COVID, right? And it's hard for people to really deal with medical issues if they don't know what they should be looking for.
Yeah, and what kind of reaction are you getting? Any more plans for another sign, possibly?
The reaction is mixed as usual. I mean, a lot of COVID-19 policy and handling has turned highly political, and unfortunately, because it's public health. It's really black and white. It's facts or not, and it's not something that opinion should really have a major effect on. But when that information isn't given to the public and they can't make the educated decisions for themselves, it's really hard for people to, abandon just, their opinion and their emotions when it comes to this stuff. So some of our, the response has been pretty negative, but a lot of it has been, pretty eye-openly, it's positive, and people are happy that people are talking about it because now we're getting all these comments like, wow, I didn't even realize, or I've been suffering with this, or my a condition that I had before got really worse since I had COVID and things like that. So we're going to keep sort of pushing for the government to start sharing that info that they've been getting continuously, right? And to hopefully they'll match our current COVID policy with the reality that we're facing right now. So We're going to put up more billboards. But I mean, this is something that we really need some help with, and everyone should know about, right? Because those are staggering numbers, 3.5 million, and it doesn't even include kids. And there's probably still a lot of people who didn't, report it, accurately. So who knows how many people are out there suffering? And the bigger problem is that with each infection, your chances of long COVID increases. So, I think after 3 infections, the chance of long COVID is about 38%. So that's a pretty high number. So people are really rolling the dice and they don't know they're playing the game. Right.
Well,
so,
Keith, I know you mentioned you've gotten a lot of mixed reaction. Either way, you've gotten people talking with your billboard. It is bright and people can see it, and your message is getting across one way or another. I want to thank you for your time, Keith Muse, a COVID-19 awareness advocate.
Thank you. Have a great day.